also tells us, if we look at passive, just relax your head down, it also tells us, you know, if there's something locked up or if there's arthritis or what's going on there, okay, it's muscle spasm, etc. So if I'm going to do passive, I generally will do extension in this position. Just scoot towards me a little bit more. And you have to get your patient to relax, so just let your head, yep, let your head be heavy like a bowling ball, and kind of do that oscillation thing where you just get them to relax. And then I would measure letting it go down. But understand it's not going to be easy to measure what's going on here and here. And you won't see a whole lot of therapists do this. Actually, come back just a little bit more. She's hitting the table, so in order to get full extension, keep like probably another 6 inches. Okay, good, right there. So then I would do it would be parallel to the floor on the nares. And then I'm just going to let her head go down as far as it'll go. And I have to measure that. Okay, so that's pretty tricky. Okay, flexion, same thing. You're going to bring them up into this position. Okay, now slide down, Kathy, so your head's on the table. Now lateral flexion, you don't necessarily have to have their head off the table. You don't really even have to have it off for flexion, just extension. We can do rotation here. I can take her passively, right, measuring, and I'm going to passively take her back. And lateral flexion, I'm not going to put her prone so I can see C7, because then her face is going to be like this and I'm going to be laterally flexing it, right? So I would do lateral flexion here, and I would have to measure where I think C7 is by finding it with my finger back there and then having that kind of an imaginary line to measure that. Okay? Therapists generally